The NSABP P2 trial, STAR trial, tamoxifen versus raloxifene. Welcome to the Everything Surgery podcast, where we delve into pivotal studies shaping the future of medicine. Today, we focus on the National Surgical Adjuvant Breast and Bowel Project P2 trial, better known as the study of tamoxifen and raloxifene, or the STAR trial. The primary aim of this landmark investigation was to compare the effectiveness and safety of two medications, raloxifene, commercially known as Evista, and tamoxifen, in reducing the risk of invasive breast cancer among postmenopausal women considered to be at high risk. This large-scale study was sponsored by the National Surgical Adjuvant Breast and Bowel Project and funded by the National Cancer Institute. Between 1999 and 2006, nearly 20,000 postmenopausal women, with a mean age of 58.5 years, were enrolled. These participants were identified as having an increased risk for breast cancer, either because their 5-year risk was estimated to be at least 1.66% based on the Gale model, or due to a history of lobular carcinoma in situ. The design of the trial was rigorous and comprehensive. It was randomized, double-blind, and controlled. Participants were randomly assigned to receive either 20 mg per day of tamoxifen or 60 mg per day of raloxifene for a duration of 5 years. After a median follow-up period of 81 months, the results were illuminating. Both raloxifene and tamoxifen were equally effective in achieving the primary goal of the trial, reducing the risk of invasive breast cancer. Each medication decreased risk by approximately 50% compared to placebo, as demonstrated in earlier studies. This established that raloxifene was not inferior to tamoxifen in preventing invasive disease. However, differences emerged in secondary outcomes. When it came to non-invasive breast cancers, such as ductal carcinoma in situ and lobular carcinoma in situ, tamoxifen proved to be more effective, reducing the risk by about half when compared to raloxifene. Raloxifene did not show a significant benefit for non-invasive disease. For estrogen receptor-positive breast cancers, both medications were highly effective, with no significant difference between them. The safety profiles of these drugs were also a major focus. Raloxifene demonstrated notable advantages in this area. Women taking raloxifene had a 38% lower risk of developing endometrial cancer than those on tamoxifen, with the risk level similar to that seen in placebo groups from earlier trials. Additionally, raloxifene was associated with a 29% lower risk of pulmonary embolism and deep vein thrombosis. There were also fewer cases of cataracts and cataract surgeries among the raloxifene group. Women reported fewer daily side effects, such as hot flashes, vaginal discharge, and problems with bladder control while taking raloxifene. Importantly, there were no significant differences between the two groups in rates of stroke, heart attack, bone fractures, or the occurrence of other cancers. The conclusions of the STAR trial have had a profound impact on clinical decision-making. For postmenopausal women at high risk for invasive breast cancer, raloxifene offers equivalent protection to tamoxifen but with a more favorable safety profile, especially regarding uterine health and blood clotting risks. In light of these findings, the United States Food and Drug Administration approved raloxifene for breast cancer risk reduction in postmenopausal women in 2007. For clinicians and patients, the STAR trial provides clear guidance. Tamoxifen remains the only chemopreventive option for premenopausal women and is superior for reducing non-invasive breast disease. However, raloxifene is now often the preferred choice for postmenopausal women, particularly those with a uterus, due to its improved safety profile. Ultimately, this study solidified selective estrogen receptor modulators as a viable and effective prevention strategy for women at high risk of breast cancer. In summary, the STAR trial demonstrated that raloxifene provides the same level of protection as tamoxifen against invasive breast cancer in postmenopausal women, but with significantly fewer serious side effects, making it a safer chemoprevention option for this population. Thank you for joining us on this episode of the Everything Surgery podcast. If you find our content informative, please like, share, and subscribe to stay updated on the latest in surgical research and innovation.